Hi everyone, it's Rob here from gotoimaging.com, and I just wanted to share a quite interesting case and a few images of a spinal MRI scan that came my way recently. And I'm going to call this one, if it's not in black and white, doesn't mean it's not there. And what I mean by that is, I think a lot of the times, if it's not on the MRI report, then as therapists, often because we don't get much training in MRI scans, it's then we then dismiss it and we don't then consider it as an option, really. So with this particular patient, it was a lady who'd had many, many years of back pain, and it was right-sided back pain. And long story short, she'd seen lots of different therapists, consultants, in fact, all the big names in the industry. And how it happened was they contacted me because initially they were interested in receiving some shockwave therapy for what they said was a Sacro-Iliac joint problem. And after a similar friend of theirs had received treatment from him and had gone quite well. And basically they were telling me an initial inquiry saying, right, I've got a Sacro-Iliac joint problem and I've tried so many different treatments, and really if this shockwave therapy doesn't help, I'm now going to have surgery. And they were going to have a fusion of the Sacro-Iliac joint. And they admitted that it was a controversial thing. Some surgeons said to have it, some said not to have it, and it was kind of a point of no return, but with the gamble. Anyway, so obviously quite a bit of pressure on me, because I thought, well, hang on, yes, if this doesn't work, then that is going to destine this patient to having surgery. So I said to them, okay, just to satisfy myself, can I please see your MRI scan images? So, yep, they got everything together and they sent me over the MRI scans. Now, what had actually happened was, it was quite likely, and it did sound plausible, very plausible, they did have a Sacro-Iliac joint issue. And the reason why I say that is they'd had CT SPECT scans done. So that's the CT SPECT scan behind me here. So we can see kind of hotspots, and evidently there'd been some hotspots over that right Sacro-Iliac joint. And they'd even tried a couple of injections, and injections had given some temporary relief, but that temporary relief only really lasted for a few hours to a few days at most. I think a couple of days at most. So it wasn't curative. So, but anyway, you kind of think, well, okay, it did have some effects, and maybe it is a Sacro-Iliac joint. But as I said, I wanted to satisfy myself that, if we were going to do this treatment, that it was definitely the right thing to do. So I'm going to share now my screen. I'm going to show you some of the images that I looked at. Okay, and this is just a sagittal image now. You can see it's a T2 weighted image. And we can see here, the alignment's not too bad, a little bit of something going on the L3-4 disc. There's a slight little bulge on the L5S1 disc. But actually, alignment's quite good, no spondylolisthesis, so that's encouraging. Doesn't obviously show us the Sacro-Iliac joints. But now here, this is an axial image through the L5S1. And yes, we're getting a glimpse of the top Sacro-Iliac joint, but doesn't really give us much information. This isn't a choroidal image. But the thing which stood out initially for me was the fact that we had this here. This is a far lateral disc bulge, in this case going to the left-hand side. So I just double-checked. I sort of went back to the patient and said, right, just tell me again, is the symptoms on the left or the right? Because there's something I'm saying. No. There's the symptoms on the, it's all on the right-hand side. So this is the right-hand side here. And evidently they'd actually tried a nerve root block. And actually see there's potential here for some nerve root impingement on the L5 exiting nerve root. You can see it's a bit more capacious there. This is a bit more narrowed. And evidently I had actually tried a nerve root block on the L5 and that hadn't worked. So fair enough, you think, okay, that's kind of maybe eliminating that out. Maybe it's not an L5 issue, nerve impingement. And, all systems go for the Sacro-Iliac joint idea. Now, but then the next thing I then went back and I thought, well, okay, there we have got some, on the left side, we can see there's a little bit of difference in the lumbar rectus spinae muscles. Could this all be soft tissue? Has the patient exhausted all non-operative options at this stage? Will this respond to some really good dry needling, some manual therapy, some deep massage, sports massage, whatever it would be? You're getting a sense here that the LES on this right side may be a little bit more, I don't know, thickened, hypertrophy, or just tonic. There's a little bit of fat infiltration, a little bit higher signal here, so maybe a little bit of deconditioned muscle. Anyway, the word came back that they'd done loads of core exercises, sick to death of them, had tried dry needling before, had tried traditional acupuncture, medical acupuncture, had tried some soft tissues or trigger point therapy. Again, nothing that really helped. So, okay, fair enough. But then really the thing that stood out again for me, I thought, well, it's going to be worth just checking here, is that if you look at this facet joint here, this is a really thickened facet joint at the L5S1. And you can see how different that is to the other side, to the left side. And so I thought, well, look, I better ask the question. I asked the question, I said, has anybody mentioned the L5S1 facet on the left side, right side, as a potential source for your pain? And have you actually tried any injections on that? I know you tried the injection of the Sacro-Iliac joint, but have you tried the Facet joint to inject? And would you believe that they came back and said they hadn't? So in nearly 20 years of having suffered with this issue, evidently only one previous consultant had said that in their opinion, this patient should try a Facet joint injection. And they'd seen, I think it was in the double figures in terms of spinal consultants that they'd seen. So I went back and said, listen, certainly before we go down the surgery route, I would suggest trying a L5S1 injection of Facet joint ahead of any surgery, because that's certainly something that hasn't been tried, and that would be a much, less invasive and wouldn't be a point of no return option to try ahead of having that Sacro-Iliac joint fused, which could potentially make things a hell of a lot worse if it wasn't actually a Sacro-Iliac joint issue and it was an L5S1 issue. And I said, then secondly, I said, if we were going to try some treatment for me, I'd be probably more interested in trying something like shockwave over the Facet joint rather than, or maybe in addition to the Sacro-Iliac joint. So, like I say, I just wanted to put that up as the sort of thing that sometimes the different routes you end up going down and educating the patients in once you start looking at these MRI scans. And if we just relied on the reports, which would have been focusing previously on the Sacro-Iliac joint, this would potentially continue to be ignored, missed, and not really thought about and looked at. And none of us really wants our patients to go down the route of having potentially controversial surgery until they've exhausted all other avenues. So anyway, I hope that was useful. I hope that was a good illustration of how to scrutinise and what can come out of scrutinising these MRI scans. And yeah, catch you again soon.